victories, Frederique was the architect of the campaign that cut the number of New York City marijuana arrests by more than 99% since 2010. I'll just say, Frederique has received many honors. She is a graduate of Cornell University and also of Columbia University with a master's in social work. Frederique, please tell us how we can move closer towards health and belonging. Thank you.
Well, first of all, thank you for having me. Again, my name is Kassandra Frederique. I am the Executive Director at Drug Policy Alliance. We are a national organization that works to end the war on drugs. Does that mean I am for the legalization of drugs? Yes, actually. I am for legalizing what? You are also getting, this is my first in-person talk. In 3 years, I'm a little nervous, definitely rusty. That's why I asked for 40 minutes back on the clock. All right, y'all, let's see how it goes. So why am I here? You know, people in this country are fed up. They're fed up with our inadequate solutions to homelessness, to addiction, to mental health. Right? People are upset. We're seeing it in the news, right? Yet people are stumped as to what to do next. While some people are pushing for law enforcement, there's a growing group of people who are building a bridge to a different world. One that doesn't include stigma, criminalization, and coercion. I'm here because I am very concerned that those people who are building our new world will again neglect to center our loved ones. We can't afford to build a new world that doesn't adequately support the needs of our people. And that is why my title of this talk is Building Our Table. Unapologetically centering our community's needs so that all people can thrive. The war on drugs and its health impacts. My colleagues talked to me about this and they were like, you're going to healthcare for the homeless? They kind of know this stuff. So I'm gonna go really fast on this, right? So drug offenses are the leading cause of arrest in the United States. So it means if someone is engaging with law enforcement, the number one reason why they're more likely to be engaged in that is because of drugs. Because they suspect someone is under the influence, they suspect someone has possession, or someone is selling and trading. The number of arrests in 2020 in the US for drug violations was 1.5 million people. Okay? And the vast majority of those arrests were for possession. Black people are 24% of those arrested, despite making up 13% of the US population, and we know why. It's not because Black people are more likely to use drugs, it's because Black people are more likely to be targeted, surveilled, and criminalized, right? They're in our neighborhoods, they're in our homes, they're in our clinics, they're in our safe spaces. And it is not a coincidence as to why certain people are criminalized more than others. Especially when we talk about drugs, race and xenophobia has been embedded in the drug war from the start. The war on drugs targets low-income people, racial ethnic minorities, and it puts the thing about drugs, which it sounds very similar to the things that y'all deal with, is that they put the onus of the problem on the individual to change, rather than change the policies that created the conditions for people to be in these terrible situations. Bobby told me I can't curse, so it's going to be really hard. The approach has been disastrous, right? The health impacts of incarceration are deleterious. We see that overdose has shot up 600% in jails and prisons. 600%. 100%. People put people in jail and prison because they want them to stop doing the behavior, right? So we're supposed to be safe in jails and prisons from drugs, right? From violence, from sexual assaults. Yet how many people in this room actually believe jails and prisons are a safe place for people to be? Raise your hand. How many people in this room know that jails and prisons is one of the most dangerous places you could be to deal with complicated human behavior? Y'all better raise your hands in here. And it's on purpose. This is the thing that I refuse to apologize about. This is the reason why I think we need to unapologetically center our needs. Because these people knew what they were doing. These policies that have encapsulated our communities, Black, Indigenous, Latino, queer, are on purpose. They made these policies because we are not supposed to be in the public. Because we are not supposed to be seen. Because they want to protect their property value. This country is created on stolen land and stolen property and stolen labor. And that is what they are protecting. Our policies are not to protect people. They're to protect capital. They're to protect property. And they will do anything to disappear our community members. They do everything to disappear my loved ones, your loved ones. So when we talk about the war on drugs, the reason why I'm standing here today, why this is my first conference in person, why I'm not in my family room, this is y'all family room. I'm gonna ask to be a part of your family, but I'm not with my people right now. The reason I came here first is because we are under attack. When we look at the overdose crisis, Black people are dying at the highest rates. This is different, right? Because since the overdose crisis started 20 years ago, we have lost 1 million people. And estimates suggest we will lose over 100,000 people alone in 2021. And 2022 does not look much better. And in fact, it is on track to be higher. And one of the reasons that I'm also here is because I know that not all people who are unhoused struggle with drug use. I'm very, very clear about that. And I also know there are people who are unhoused who are also struggling with addiction. That those two things can be true statements. And it is important that the stigma that our communities have on each other do not conflate and do the work of our enemies. We're working for them when we hold the stigma against our communities. I know that people who struggle with substance use, most of those people are housed. But I'm here because of the people who are not. The people that are navigating addiction, the people that are dying in our homeless shelters, the people that are dying on the street, because every overdose death is preventable.
That's right. That's right.
It is preventable. And the thing that is so interesting about this moment, for me, is that I recognize that Bobby could come up here and give this speech at the Drug Policy Alliance conference and would be saying the very similar things. Nothing, you could literally switch out drug policy and addiction and overdose with the stats of people that are unhoused. When we think about the stigma, when we think about the lack of access to resources, when we think about the criminalization, when we think about the surveillance, and when we think about the stigma. Am I lying?
Tell the truth. Speak the truth.
Listen, I'm from New York. It is very early. And if I'm gonna stand up here, you're gonna talk over here. So do you hear me? This side of the room sounds very quiet. Do you hear me?
Yeah.
Thank you. For the first time ever, the overdose rate, as I said, is highest among people of color, specifically Black people. And this point I want to say here that you see is that because the overdose crisis is going up amongst Black people, the concern around overdose among white Americans has gone down. Y'all see that? And part of it is because when we started with the overdose crisis, the conversation focused on how doctors were literally over-prescribing. Y'all remember that? And that people were accidentally falling into addiction. The research showed that that was not the case. Now, I'm not saying that Purdue's and the Sacklers were not capitalists and flooded our communities. What I am saying is that the people that struggled with addiction, those prescriptions were not theirs. But what do we gain from the rhetoric? We gain the protection of the idea that some people are supposed to be addicted and some are not. There are similar thoughts and narratives between our communities that consistently make it difficult for us to meet each other in the middle and for us to move forward. And criminalization continues to be the thing that they push on us and on you. Understanding that we have to get rid of these encampments. We have to get rid of these people using drugs in the street. We have to get them inside, and if they don't want to, what is the thing at stake? Our autonomy. They want to tell us what to do. That's why they put us in jails and prisons, because they can control us there. And the thing that is at the crux of the work that we're doing is people's right to exist, their dignity, and their ability to do what they want, and to make choices for themselves, and for people who are service providers to respect them and build a plan that works for them, not for our own comfort levels. Just so y'all know, I usually don't speak with notes, but because I'm in charge of DPA now, they really want to make sure they know what I'm saying. So some of these slides don't match, okay? Y'all know this stuff already. You know, homelessness and overdose deaths are skyrocketing. It's one of the leading causes of deaths of people that are unhoused. This is a stats from LA County. Continue. This is how you know someone at DPA made these slides, right? They're like, focus on overdose, Kassandra. Don't talk about taking down capitalism. Where I'm at right now. Sorry, Barbara. You know, one of the things that I said earlier, right, was the idea that the reason why we're in this situation, oftentimes people put the onus on individuals. But the thing that we have learned, and the thing that y'all know already, is that they have created these conditions. They have literally created the policies that make it difficult for people to live and to thrive and to make choices that work for them. And for a long time, the organization I work at, we focused solely on drugs. We just wanted to deal with ending drug prohibition. We only thought that that was our only lane. And as Bobby said, I'm a social worker. I do believe in the abolition of social work because I think it's a problem, but I'm currently a social I have the student debt for social work. And the thing that I have realized and I sit with is that the drug war is in every system that people engage with. That it's not just the criminal legal system that puts drug laws on people, right? That it's every single system that people engage with have been perverted with the drug war logic. So it's not just judges and prosecutors and police officers that are enforcing drug laws. It's social workers in the child welfare system. It's teachers in the education system. It's caseworkers in the public benefits office, right? It is the housing counselors that are going out of their way to not give people the resources and services that they need. And I think it's important for us to be really clear about who is enforcing these laws. Because a lot of people no one sees them. There is this invisible web of actors that are going out there every day making it harder for your clients. They are putting up arbitrary laws that make it difficult for people to get the resources that you have searched for. There are people who are kicking people out of programs, kicking people out of shelters, based on rules that don't make sense for the conditions people are living under. And then we wonder why people are unhealthy. We are in a state of gaslighting. It is structural, it is systematic, it is insidious. And even every good person here, even if you know everything that I'm saying, we all still hold that bias. It is something that we actively have to work against in order to show up as a full human being for the human being that is sitting in front of us. That is the work they don't pay us for. That is the work they don't train us for. That is the work they don't develop us for. And so when we talk about uprooting the drug war from these different systems, it's not just from the systems, it's from our spirits as well. It is understanding that we are at this moment because we're all a part of a system, intentionally and unintentionally, subconsciously and complicitly. Evictions and homelessness are associated with increased related drug health harms,
Right.
including overdose and syringe sharing. And I know a lot of people here, Jack told me that his organization started as an HIV/AIDS organization first, like that was part of the conversation. So we know what it means when people are sharing equipment. We know what it means when people have to deal and use chaotically in the street because they don't have places to go. And our policies make that so. And then we blame people for the conditions that they live under, the conditions that we have created. The Coalition on Homelessness in San Francisco surveyed unhoused people who use drugs and found that nearly everyone said they could not address their drug use without housing first. This is my dear friend, Emily Ramos. She talks about her father and his struggle with drug use. And the fact that his drug use precluded him from keeping his public housing. And how that caused him to be unhoused. And how that actually made his drug use more chaotic. We know, at Drug Policy Alliance that housing insecurity is deadly. We know that eviction increases the risk of overdose deaths and homelessness, and that tens of thousands of people have lost their homes based on their drug use, based on these misguided policies. I'm here because the drug war creates your clients. And I need to work with you, and you need to work with me, because we won't end homelessness if our policies continue to make unhoused people. In the 3 years of the pandemic in 2020, these are the headlines that were hitting all over the newspaper. Homeless evicted from Minneapolis hotel after drug overdose. Surviving an overdose can get Midwesterners evicted. Granite City renters face eviction over drug overdose 911 calls during opioid epidemic. West Virginia cites evictions to combat opioid epidemic. Forced out of a home over a marijuana joint. What the hell are we doing? Hell is not a curse, God. What are we doing? I don't know about you, but I have dreams of doing something else than ending the drug war. I want to be chilling with Rihanna on a yacht. I don't know if you have those dreams, but if you could do something else, what would you do? How would you spend your time? We're in this room because we care. Because we can't let wrongs go unrighted. Because we believe in the dignity and autonomy of people. And we believe in the power of change. And we should all be trying to work ourselves out of the job. But we can't do that right now. And we can't do it because of the moment that we're in and the policies that continue to dictate our well-being. You know, I heard the theme, right, toward health and belonging. As a Black woman from the United States, I don't want to belong to this shit. I actually don't. And I don't think you want to either. You know, we're in this moment where there is a conflation between public disorder, right? The presence of unhoused people, the presence of open-air drug markets, the presence of drug use, the presence of people having severe mental health crises, and violent crime. How many people are watching the news and hearing how this country is going down the toilet, right? That our cities aren't the cities they used to be. Everything is terrible. We're falling out of control. Who are they talking about? What is making people think the city is going down the tubes? What are people actually talking about? People are upset because they see visible poverty.
There you go. There you go. Right.
Because they see people and they're scared. Yeah, those are the people that have the most power. Isn't it hilarious when the people with the most power are the scared ones? And when the most powerful are scared, they are the most dangerous. That is when our rights become eroded.
True that.
And I want to be clear. Folks are consistently talking about the public. But we are the public too. People who are unhoused are part of the public.
Hey.
people expendable. And they have used fear as a reason to make those people expendable. To make the question less about how do we make these people healthy, whole, and housed, and more about how do we disappear these people? How do we make sure that I'm not scared walking to the train station? How do we make sure that the streets are clean? How do you make sure that I'm clean? How do you make sure that I have access to a public bathroom? How do you make sure that I have clothes that I need, that I can be warm, that I can stay dry when it rains? Why are those the questions? Why are we focusing so much and letting fear drive our policies, letting it be used as a reason to erode our autonomy, our dignity, our resources? When I got to the Pacific Northwest, I was in a Lyft. I literally was in the Lyft for 2 minutes. The woman says to me, you know, Portland is a great city. It's being tarnished by homelessness. And I was like, oh, it's not being tarnished by unaffordable housing? It's not being tarnished by the overbloated budgets that you're giving to law enforcement to go and like talk to people and take people's belongings and throw them out? People are just so weird. The underlying logic of this conversation undergirds the drug war as it undergirds unhoused people, right? It's this idea, this twisted logic that prioritizes property and capital over the rights and dignities of people, right? People who use drugs and are unhoused are untrustworthy. People who use drugs and unhoused can't be good tenants, parents, or community members. That we are a burden, that we need to be forced to comply, that we don't make good choices, can't manage our money, are wasteful, and we are dangerous and threatening. What all these logics have in common is using stigma and marginalization to blame individuals for systematic problems. Failure of our policies and systems being used as an excuse to double down on criminalization. People talk about COVID as if it opened their eyes to a new situation. But what I heard Bobby say is that y'all were here in 2019, which means y'all were also here in 2018, 17, 16, right? So this issue that y'all have been dealing with is not COVID related. COVID may have exacerbated the conditions that we work under, right? But if everyone was housed before COVID, we wouldn't be here, right? If we had dealt with the issues that we had, a worldwide health pandemic would not have busted this thing wide open in the ways that it did. It wouldn't have created more unhoused people. It wouldn't have pushed more people to struggle with addiction. What COVID did was supercharge what we were already dealing with. Yeah. We were already drowning. We were already struggling. And COVID just increased the pressure. But it also opened the door for new solutions. The thing about COVID is, all of a sudden, everyone was like, maybe we should give people rooms. Was that not weird for you? For me, I was just like, you think? You know, for us, it was like, maybe we should give people take-home methadone. I was like, you don't say. universe. Amazing! This moment is not about resources. We have them. It is about political will. And it is about ending stigma, right? And stigma is legalized discrimination. It's about moving the funding from law enforcement to be shifted to people that are providing resources, right? And I think the thing for me is that I want to know from you, what will it take for us to defend the dignity of our communities in the middle of this pushback, where people are asking us to apologize for our existence? How can we avoid throwing people under the bus? We need a radical, inclusive love that does not leave anyone behind. My friend used to work at Victoria's Secret. And she told me that whenever they were ready to storyboard, they would think of a particular person. This was a person in the design room that they all thought about. Her name was Jessica. She was a young white woman in the Midwest. And so when you think about Victoria's Secret and the stories and the fashion show and the kinds of bras and underwear and robes and perfume, they thought about Jessica. Will Jessica buy this thing? And that has always been super moving for me as someone who is an organizer and someone that does legislative advocacy. Because if we want to build a new world, who are we building it for? And this goes back to the belonging. What is the world we want to build? What are the values? If we are building a better world, we need to start with our folks, rather than retrofitting our folks in after the fact. What does a Black, disabled, trans, queer, unhoused, sex working, and drug using person need to thrive? That is the question that is centering the work that we do at the Drug Policy Alliance, and I offer to you. If we want to build a new world, we have to disabuse ourselves of the idea that we can belong in this one. Because this world was never built for us. There's so many people in this room that this world never took into account. I encourage you to look at this report from one of our allies called SNAPCO, Solutions Not Punishment Collaborative, which is a Black LGBTQ community organization fighting for everyone Black in Atlanta. And everyone else. But they say we're fighting for everyone Black. Kind of like Lisa Ray, which was like rooting for everyone Black. I don't know if you know the reference, but you can do it. They wrote a report called Deeper Than Visibility, understanding that they needed to build a legislative advocacy movement building infrastructure that focused on dignity, autonomy, power, healthcare, homes, money, fulfillment, and abundance. These words mean more to me as someone leading an organization because I recognize that I need to stop apologizing for people for using drugs in the street. I need to stop apologizing for people who are selling drugs. I need to stop apologizing for people who are navigating really hard situations. Because there is a conversation and a space for personal accountability. But there's a bigger conversation as to why people are navigating the conditions that they are. And that's the conversation that we rarely have, and that we rarely stick to. And y'all know that because of the work that you do every single day. You know, I am a harm reductionist, and I think a lot of people in this room would also identify as harm reductionists. And part of the reason that we're here is as an invitation. We know that we can't do this work without you. And I want to implore for you is that you can't do this work without us either.
Right. Yeah.
We need to come together across silos and recognize that we are in the same fight. Because the things they say about you are the things they say about us. And recognize that harm reduction is a verb. And to us, that means when we talk about our harm reduction, that our issues around overdose prevention centers, syringe exchanges, low threshold medication maintenance, and supportive housing, all things that we know are evidence-based interventions, I'm asking you to work with us to include them in the healthcare that you provide in your institutions. Healthcare for people who use drugs is more than naloxone. It's giving people access to syringes. It's giving people access to safer smoking kits. It's understanding that some people need to use drugs to survive and navigate the conditions that they're doing now. And we can't be in a world where they're getting healthcare over here or getting housed over there and using drugs over here. Those things have to come together. It's hard, it's difficult, I understand. But our people are dying. And the whole point of me being here is because my people are your people. They are our people. They are my cousins. Decriminalizing drug possession, removing drugs from the criminal legal system, and will allow other avenues for people to get access to resources and offering community-based alternatives. So one of our biggest questions to you is how do you infuse those things into the services that you're providing currently? When I looked on the Healthcare Formula's website, I saw that it said harm reduction, and it said motivational interviewing, it said yoga, it said all these different things. But next year I wanted to say syringe exchange. Next year I wanted to say overdose prevention centers. Next year I wanted to say safe supply. I wanted to say housing first. Because my people are here. They're here. My cousin was unhoused. We found him in the park by himself, dead. I care. I know you care. We have to care together. We have to care together. We are pushing for innovation. We are pushing to build a new world that centers the people that need the most. Those people are not a burden. Those people are us. They are what we need. They're what we understand. There are conversations that are happening in our spaces that are happening in separate rooms. And the cost of that is lives. I know that the stigma associated with drug use makes your work more difficult. I understand that. But I also understand that that stigma is created so that we don't work together. And so that it makes it harder for the people that you work with. As healthcare providers, you can do a lot. Clinicians are powerful advocates. And I say clinicians, I don't mean doctors. I mean the people that are doing intake. I mean the people that are walking people to resources, to housing, that are filling out forms for people, that are doing street outreach. We are all the experts. And there's a lot of work that we can all be doing together. We are ready to do the work, to build the bridge, to create our own public, to invite people to belong to our community. I hope and pray that you are willing to do it too. Thank you.